My name is Patricia Hanna, and I'm a clinical specialist with the Specialized Care Branch at CIHI. And thank you so much for joining us today and welcome. We're so pleased to be hosting this session with guest speakers representing Health Excellence Canada and the Responsive Health Management Group. So over 230 homes across Canada participated in a 12-month quality improvement program supported by Healthcare Excellence Canada. So in our session today, our presenters will be sharing examples on how reimagining long-term care supported homes to identify, plan, and implement improvement projects focused on fostering healthy work environments that enabled safer, higher quality person care. So very exciting. So before we begin, I would like to take a moment to complete a land acknowledgement. So as we find ourselves connecting remotely from across the nation, CIHI would like to collectively acknowledge the ancestral and unceded lands that we all occupy, of all Inuit, Métis, and First Nation people that call this land home. And I'm situated in Ottawa, which is on the land of the Anishinaabe Algonquin Nation. So before we jump into our presentation, it'd be nice to get to know who is on the line with us today. So I'm going to be launching a few polls. And the first one is just simply to tell us what province or territory you are joining us from. So I'll give you a few moments to go ahead and do that. So we have a big British Columbia there. I'm just looking to see if there's anyone else joining from other provinces or territories. All right, so it looks like we have quite a bit of folks from British Columbia, so this is excellent, wonderful. So let's take a look. We have another poll that I'm just going to open up. So let's just do that. And this one is about what your role is. So in a word or two, what your role is in your organization. So we have educator and administrator, director of care. Got about 40 responses or so. All right. So excellent. All right, so let's get started with our session. So let's get to know our presenters for today. So our presenters today are Neil and Julienne. Neil is the Director of Innovation Programs at Healthcare Excellence Canada, and he's a seasoned occupational therapist with extensive clinical background across various settings. And Neil has been deeply involved in quality improvement throughout his career. He's held leadership roles such as chair of the Quality Improvement Committee at the University Health Network and co-chair of Emerging Health Leaders Ottawa. Neil earned a Bachelor of Science in Occupational Therapy from McGill University and a Master's of Health Science and Health Administration from the University of Toronto. And also with us today is Julienne Latam. She is a nurse consultant for the Responsive Health Management Group. She's been a registered nurse for over 30 years and was previously director of care in 2 of the HRM homes. And Julienne will be sharing her team's experience with us, where the homes focused their work during the 12-month quality improvement program. And with that, I'm going to turn it over to you, Neil.
Thanks so much, Patricia. A wonderful introduction. Oh, sorry, Jacqueline. And I know Patricia is here as well from CIHI. They just started drilling in the office, so I'm hoping it's not as loud on everybody else's end as it is on mine. But just going to share some slides here, and we'll get started. And can people just give me a thumbs up if they see those slides? Okay, great. So again, thanks so much for everyone joining today. So my name's Neil, and I'm going to be talking a little bit about the Reimagining Long-Term Care program that was supported by Healthcare Excellence Canada. And I also wanted to point out that I'm joined today by my larger team at HEC, Nicole Pollock, Kirby Curvin, and Joanna Burke-Bajaj, who will also be around towards the end of the presentation if there's some specific questions. But really excited to talk to you a little bit more today. I wanted to start as well by acknowledging that I am also joining from HEC offices in Ottawa, and we are as well on the traditional unceded, unsurrendered territory of the Algonquin people. At HEC, we honor the traditional territories across the country where our staff and partners live, work, and play, and we recognize that the stewardship of the original inhabitants of these territories is part of the reason why we enjoy the standard of living that we do today. So just a couple of, I just wanted to talk very high level about HEC. Similar to CIHI, we're a pan-Canadian healthcare organization, and really our mission is to shape a future where everyone in Canada has safe, high-quality healthcare. And we do this by working with diverse partners, such as many long-term care homes across the country, as well as partners at the system level like CIHI to support lasting improvement in quality and safety. And we're a relatively new organization. We formed only a few years ago in the middle of the pandemic with the amalgamation of the Canadian Foundation for Healthcare Improvement and Canadian Patient Safety Institute, and we're primarily funded by Health Canada. So you could see on this slide here a little bit more about our strategy, but really I just wanted to draw your attention to our how. What is it that we do? So a lot of our work is we always do this in partnership, but we spend a lot of time and effort finding and promoting those innovators and innovations that are showing promise and in making those improvements in quality and safety in the healthcare system. And then a lot of our energy is driving the rapid adoption and spread of quality, safety, innovations, and improvements. We know improvements in the healthcare systems can take the form of many different forms, but part of our reason for being is we want to go beyond the land of pilot projects and really share and learn from each other. And some of where we focus our efforts, we're a relatively small organization. We're only about 100 people with folks across the country. Our current focus areas are care of older adults with health and social needs, which I'm sure you'll realize aligns a lot with the resident population of long-term care, care closer to home and community with safe transitions. And also a lot of our effort these days is on supporting the retention of the health workforce. And everything that we do, we try and embed our quality and safety perspectives, which include things like ensuring there's the voice of the lived experience of patients and families, looking at cultural safety and equity, and again, thinking about how we can support and work with the workforce. So I have a poll as well, and I'm just, how do I get this? I need to start presenting, but why? Just seeing, I thought I had launched this poll. But let me see if I can join the poll. Just while I'm figuring that out. Can people still see that? Hopefully you can. So I just want to get a sense of how many people on the call today work at a site that has participated in a HEC LTC program, and if and you can join the poll by just using your camera on that QR code on the screen, or you can go to slido.com and enter that number there, but I'm not sure if it's working. So if it's not working, you can also just go to just enter your responses in the chat. Okay, so you're not seeing the QR code. Apologies for that. It was working when I set it up, but yeah, just feel free to enter your responses in the chat. Particularly those, I'm curious to know if those who currently work at a site that has participated in one of our past long-term care programs at HEC. So sounds like a lot of folks have not. Healthcare Excellence Canada, HEC, pardon me, is Healthcare Excellence Canada. So there's a few that have, but many have not, which is great because we want to share a little bit more about the experience of our programs today with you. So yeah, I'm using an acronym, and apologies for that, Healthcare Excellence Canada. So feel free to continue entering your response in the chat. But so I wanted to share a little bit more about what is Reimagining Long-Term Care. So it was a program that was started in 2023, a 12-month program. And really the goal of this was, as Jacqueline had mentioned at the top, to support and increase capacity for quality improvement within long-term care. We also, and part of that journey was for participating sites to identify and plan and implement a quality improvement, a change that would align with enabling a healthy workforce to deliver person-centered care to residents. And then along the way, there's many opportunities to foster peer-to-peer sharing and learning. And so within the 12-month program, which the program has now ended, what we offered to participating teams was things like, there was a bit of seed funding, some just initial funding to support the time around the quality improvement initiative. We also had what we called group coaching, really, and the goal there, the idea was for group coaches to support homes to move forward with their quality improvement initiative. There was a lot of people that were new to this. We had public-facing long-term care webinars, which covered a variety of topics relevant to long-term care, and we had our colleagues at CIHI present on that. And we also tried to support capacity building through things like quality improvement basic workshops and mental health first aid training. So we had over 230 homes across the country in every province participate. and homes could really decide how they wanted to where they wanted to focus their quality improvement efforts. Some homes focused on supporting a healthy workforce. Others were their projects were more focused on improving and increasing resident-centered care, and some had a dual focus. And in British Columbia, and I know there's a lot of folks here from BC, we did partner with Health Quality BC on a specific priority in the province, which was related to person-centered care, and that was improving the appropriate use of antipsychotics. And reducing the inappropriate use of antipsychotics. And so somebody now has control of my slides, so I'm just looking at my notes, but okay, so next slide. So we had a little bit, so once we got the initial snapshot of those quality improvement projects and where folks wanted to focus, we grouped homes with similar themes into hubs, and the group coaching was aligned with the hub themes. So in person-centered care, there were some projects that were focused on the appropriate use of antipsychotics, like I mentioned, also strengthening person-centered care and improving care for residents with dementia. And then homes that were focusing on the healthy workforce, they had really 3 themes. And I'm just going to see if I can go back to my notes here. And those project themes were around creating healthy workplace cultures, which were, things like supporting staff and workplace assessments, workplace charters, and educational opportunities. We also had improving staff well-being with a focus on staff morale and creating and sustaining a psychologically safe and healthy workplace environment. So, and then some of the project examples related to person-centered care. So some teams did things like training and education, different dementia types of training and education. The QUIS scores, quality of interaction schedule, which I know Julian is going to talk a bit more, sensory therapy tools. And then there was some things that were really designed to focus on enhancing residents' experience and staff interactions, like implementing care boards and life trees and door wraps. And then in terms of those projects that were focused on people in the workforce, some projects aim to improve things and the experience of working in long-term care and foster joy in work. And some examples there were resilience and wellness workshops, training related to workplace violence, and leadership training for management. And then one of the other interesting types of projects were focusing on employees leading change and having freedom, in contrast to some of the things that we saw in the pandemic policies and which were more top down. So those are some of those examples, but I think the best way to hear about some of the experiences from the program is to hear from Julian and her experience working at Responsive Health Management. So Julian, I'm going to turn it over to you, and I'm just checking if I'm controlling the slides. Oh, I think somebody else is. So Julian, over to you.
Okay, thank you. Thank you for joining me today to talk about my experience with Responsive Health Management and this wonderful quality improvement project that we did in 2023. So here we go. You can change the slide, please. Yes, so we'll start off with a message from Meaningful Care Matters. They're a person-centered organization that helps nursing homes across the entire world implement butterfly programs. So let's start with this beautiful saying. It says, a meaningful life is composed of a series of meaningful moments. If this is what we want, then the ability to infuse each moment with meaning would seem to be a skill worth practicing. And thank you so much to Health Excellence Canada for this opportunity to have the grants and be able to go into the homes and promote change and understanding. So here I am to share my journey with you. Next slide, please. So on the agenda today, we're going to talk about what is QUIS. I'll provide you some background information leading to our 2023 projects and talk about some of the key metrics involved in that. We're going to go through an exercise with 2 minutes of silence. And also we'll look at some of the shared stories of success from the homes that engaged in this project. And I'll also talk about the QUIS 2024 quality initiative that we have. And then any questions can be followed after that. Next slide, please. So using the QUIS methodology, as I told you before, it is a very important component of the Butterfly program. And in 2023, we embarked on an adventure to deliver frontline training to all of our teams on how to improve the quality of interactions in our 9 homes. And for 2024, QUIS has now become one of our quality initiatives. So on a monthly basis, each home engages in doing at least 2 hours of observations, and then it will give us a score, and it will tell us as to what level we are on the QUIS levels. Next slide, please. So what is QUIS? The QUIS tool is an integral component of a multifaceted approach used by Meaningful Care Matters Limited. And when undertaking cultural change initiatives such as the butterfly or the dragonfly approach, the QUIS tool is used as an integral part of that project. So in these initiatives, usually the QUIS assessment is performed by Meaningful Care Matters. And what we have found that based on the successful outcomes using the QUIS, it was suggested by Meaningful Care Matters that using your home staff in a managerial or supervisory capacity, you can effectively use the tool as a measure to drive improvement in the resident quality of life. And this could be outside of the butterfly or the dragonfly initiative. So as an organization, Responsive Health Management remains very much committed to improving the quality of life for each of its long-term care residents. And I'd like to also share with you that the O'Neill Center has successfully implemented the Butterfly Cultural Transformation as of winter 2023. So as it says on the screen, QUIS is a validated observational tool which measures a culture of care based on the majority of the lived experience assessed every 5 minutes. So picture this, we have a piece of paper and we have 6 columns that we need to fill. Each in increments of 5 minutes, you're going to document everything that you see, that you hear, and that you feel. Once the observation is finished, the observation could be either 30 minutes or up to an hour. Once your observation is finished, then you're going to come back and you're going to analyze each 5 minutes to see where does this interaction fall? Was it meaningful, positive, neutral, controlling, or restrictive? So in teaching about the QUIS, we embark upon a learning journey with our staff to teach them to treat every care task as an opportunity for meaningful interaction and connection. Every interaction is an opportunity to make something meaningful happen. And it is so important to know all about people's individual life history. It helps us to provide more emotionally fulfilling activities for them and when we're interacting with them. Also very important is staging the room and filling the home with the stuff of life that relates to people's interests and life stories. And also to open up and create invitations for independent occupation throughout the day, whether it's putting bibs on the table and gathering some ladies together, and we're going to fold bibs for the lunch period, or we may get out some vegetables to make a salad, and everybody would participate in that safely, helping to prepare something for lunch. The whole purpose is to help people retain and rediscover purpose and recreating life or work roles and have them feeling needed and included in the everyday life in long-term care. Next slide, please. So I'm going to talk about the levels, and I'm going to use an exercise about chocolate. So first of all, with meaningful engagement, this is when we're able to provide care seamlessly, when we're engaging in conversation. And it seems like we're friends and we're family when we're giving care. The next column is positive care. I'm going to speak to you, but only in regards to the elements of care that I'm giving. It's very pleasant, very positive, but there's no extra flowery language. When we get to neutral care, this is where there's a sense of boredom, lethargy, and if I'm doing something, I can do it in silence or with very limited verbal interaction. When we get to negative and controlling care, this is where I, as the caregiver, I'm using my control and not really asking the resident or giving them any choices. Literally, your choices are taken away because I'm here to protect you and I know what's best for you. When we get into the last category, this is negative or restrictive care. And this is, you know, talking about the residents in front of them and also violating their rights and also subjecting them to neglect. So let me demonstrate this for you in regards to the chocolate bar scenario. So I come from a very large family with 4 other sisters. And can you imagine sharing a Kit Kat bar with 5, right? And me being the youngest, I would always get the teeniest half. Not fair. And then I would offer the chocolate bar. Would you like a Kit Kat? Would you like a Hershey bar or Snickers? Right? Pleasant interaction. Move to the next category, positive care. Oh, move to, yeah, positive care. Again, I would say, would you like a Kit Kat or would you like a Twix? Enjoy your chocolate bar. With neutral care, basically, I would just put out my 2 hands, this one or that one. Not much interaction. With negative controlling care, I would say, I see you're a diabetic, so you know what? I'm going to give you half a Kit Kat. I've taken the choice away from that person. And with negative restrictive care, it could be, you know what? Don't give her that chocolate because you know what? You're just going to get messy and we're going to have to clean them up after. Let's not do that. That's an example of negative restrictive care. Next slide, please. So in 2022, our project focused on person-centered care. So we were looking at advancing the quality of life for residents in long-term care through measurement and improvement of qualitative interactions between residents and staff. Using quiz in all of our homes, started a deliberate cultural transformation journey to embrace emotion-based, person-centered care and move from a culture and work routine centered on completing tasks to one where every moment matters and the residents' well-being is based on the quality of their daily lived experience. Each home has undertaken this journey by introducing the quiz tool. And we had a 2-day training of the management teams with the Meaningful Care Matters consultant and also myself as the project lead. So with the initial training, we obtained the baseline data And then 6 to 8 weeks after doing observations, we wanted to see an increase, I should say a decrease in the negative interactions by 10% and an increase in positive interactions by 10%. Within 6 months, there was a target to improve at least one level in the quiz scores. And at the end of the year, we wanted to improve by at least another level. So 2 levels for each of the homes. That was the target that we were aiming for. So a key part of the observations is providing feedback to the staff. So at the end of each observation, you go back to the staff and you talk to them in terms of things that they did very well and also areas for improvement. The quiz also comes along with 10 different levels. Level 1 being excellent, and your home has got the it factor with dealing with interactions that are always meaningful all the time, up to number 10, where number 10 means that there's a lot of controlling and restrictive behavior. This is a home that would probably have a lot of critical incidences related to resident abuse, inappropriate conduct or incompetent conduct and so forth. And this is a home that you'd probably want to be calling the ministry to provide some additional assistance. So let's move on to the next slide. In 2023, the focus areas that we concentrated on for our project was building a healthy, competent workforce, looking at team-based approaches to person-centered care. So really focusing on getting to know the past lives or the current lives of our residents and bringing it into our care. Looking at creating a meaningful quality of life experience for our residents, and looking to provide a high level of quality of care that's based on life experience, residents' needs, and also their preferences. Next slide, please. So some of the key metrics that we were looking at were our baseline quiz scores from 2022. And we were also looking at the 3 lowest 2021 resident survey areas and also the scores. And some of the focus areas from our survey was looking at meaningful occupation, engagement during the evenings and the weekends, having a choice of sleep and wake time. And our goals were to increase the resident survey scores in these particular areas. And with the staffing, we were looking at the percentage of staff turnover in 2021 and making some measures to improve that. And we were also looking at a large percentage of staff who were on LOA in comparison to the total number of staff that we had on board. Next slide. So again, we wanted to improve the quality of life for our residents. We also wanted to address staff burnout and alleviate moral injury that occurred during the pandemic. And how are we going to do this? We're going to provide 4 hours of frontline training to the staff. For us, this was monumental because we hadn't had time to sit down and have 4 hours with the frontline staff over the last 3 years. So this was fantastic and eye-opening to do. Coverage with the funds from Health Excellence Canada, we were able to provide coverage during the training periods. And the training also included a lot of empathy training, trying to have our staff go through the experience of what it is to be a resident in long-term care. Also important to get to know each other, and also enhancing their awareness of the 5 modes of interactions based on the quiz, and also engaging in some hand-on exercises. So next slide. I'm going to put everybody through a little exercise. Everybody whose last name goes from A to K, I want you all to sit back in your chairs and look at the ceiling. All those from L to Z, I want you to lean forward in your chair and I want you to look at the floor. You're going to do this for 2 minutes, starting now. Okay, your time is up. You can give me some of your responses in the chat box of how you felt. Staring at the ceiling for 2 minutes. So imagine some of our residents in our homes. After meals, what do we do? Yes, somebody said that they felt bored. Imagine a resident who is sitting in their reclined wheelchair, not for 1 minute, not for 2 minutes, sometimes 30 minutes. Someone said they felt useless and sleepy, right? Restricted, yes. You may have a resident who's in their wheelchair for up to 1 hour, 2 hours. If it's after lunch, they could be in that position from 1 o'clock until maybe 5. Yes, it makes you shake your head. And imagine for a resident who is in a later stage and not able to speak for themselves. It's a very long time. Yeah. Oh, somebody started fidgeting and rocking back and forth. We're seeing some responsive behaviors being elicited there. Yeah, definitely very long. I agree. So this is one, somebody said it felt like eternity and they were bored. Yes, and it could make you feel tired also. Yes. So this is why we have many residents who may be seated in the wheelchair watching the TV, but what happens? Their head is down and they're watching the floor because they're sleeping. And they're bored. They're not really doing anything. Yes, it may be dull. So just to create an awareness with the staff of when they do this, the importance of putting the TV on something else other than CP24 or CNN News, like get the residents' choice in looking at the program. And on a beautiful day like this, take them outside for maybe half an hour, let them sit in the sunshine and get some fresh air, seeing the kids walk to school, and saying hello to neighbors as they're passing by. It makes a difference, right? So this is one of the exercises that we used at the home with the staff, and it was quite eye-opening. Some people complained of getting stiff necks. And they said, I didn't realize that I was doing that to the resident. It must be awful for them sitting for such a long time doing nothing. So then it propagates. What can we do to change the moment, right? So one of the lessons that went over very well. Move forward with the slide, please. So outcomes to date. Right now, we've adapted the quiz tool. So we're doing observations throughout the 9 homes on a monthly basis. And we are comparing the data and the initiatives throughout the organization. We definitely, we're seeing an overall improvement being seen with the quiz scores, because it does force the managers to get out of their office and be on the floor, doing the observations and interacting with the staff. If anything, it's enhancing the management and staff relationship. And one of the things that we have adapted for this year is that we're trying to do the observations with the frontline staff. So we'll take them aside for about 15 minutes, and then we'll say, let's do the observation together. And I can tell you everything that I'm seeing through my eyes. And then they learn through that way also. So on a monthly basis, I do have a meeting with the program managers just to check on the progress that they're having in each of the homes and what exciting new initiatives they've done for the month. And we share that success and the challenges that we're having with the quiz. One of the things that we've done for all the committees that we have in the home, whether it's joint executive director or joint DOC or joint staff development coordinator, everybody has to report a person-centered story that happened within the home. And again, some of the challenges that we had with quiz, since the pandemic, we've had unprecedented change in the homes when it comes to staff. So it is a challenge to get out to the homes again and provide more education to make sure that everyone stays up to date with their quiz observations. We've definitely seen improvements in the evening and the weekend programming. And definitely there's been some improvements in staff retention and also returning from leave of absence. And like I said before, we have person-centered discussions on all committees. Next slide, please. And we'll just move ahead. Just go ahead one more because I want to stay within the timeline that I have. So this here shows what the O'Neill Center did at their home. For them, their challenge, what they wanted to improve on was recognition for more meaningful interactions between all staff and residents and outside of the task and responsibilities, and maintaining consistency with that. They also wanted to use person-centered language at all times, and they wanted to improve on lack of purpose and activities outside of scheduled activities for residents. So what that means is getting our PSWs involved in making meaningful moments with the residents. Things like taking them outside, things like giving them coloring materials so they can color or they can paint, putting on music that they liked, whether it's on the headphones or it's on an iPad. I've never seen more iPads with Engelbert Humperdinck and Frank Sinatra on there. It's really lovely. So what happened in that, we had the lowest number of residents in the last quarter and more, less people who were at risk of isolation. And there was a few implementations of the butterfly model spread throughout the rest of the home. And this is because when we provided the training to the staff, in addition to working on the butterfly floor, they picked up shifts throughout the building, and at dull moments in the day, like after meals and so forth, they started to engage more and the stuff of life that brings meaning to residents. They knew how to do that. So what are they most proud of? They were most proud of passing their butterfly accreditation, of course, and also being able to provide multiple opportunities for the residents to enjoy their time in the home while allowing it to feel like a home. And also seeing our staff connected more with the residents and just spreading the butterfly and quiz education throughout the whole building. So that was the O'Neill Center. And if you go to the next slide, you will see some pictures of some fun things that was done at the home, including piano playing. You can see the activity with the food. I think we had a barbecue that one of the residents made Slovaki, and we sold the plate for maybe $15 each, and everything went to Residents Council. So that was wonderful. If we go to the next slide, we will see what was done at the Lancaster home. So quickly, I'm going to just talk about what they're most proud of at the Lancaster home. There was an increased awareness of residents' preferences and the ability to provide person-centered care. And they were seeing more positive interactions between the residents and the care providers. And there was also starting the late risers breakfast. So people who didn't want to wake up at 7 or 8 o'clock, but maybe get up around 10 or 11 and still have access to a full breakfast. That was wonderful. And also team members communicating more and being more involved in programs and other events. That was exceptionally well done at Lancaster. And if we go to the next slide, we'll see pictures and the fun things that they did with dog therapy and being, I think they had a lemonade stand there also. And you can see just overall joy from staff and residents joining in fun activities together. Next slide. And over here we have the Niagara team. And what they were most proud of is the staff being able to recognize their peers, They're also proud that there was more awareness of meaningful care and how to provide this for all of the residents. There was an increased knowledge in sharing meaningful stories with the residents related to the staff residents' lives, and also increased learning with how to work within the interdisciplinary team. So if you go to the next slide, our Niagara team did quite a lot of stuff and very inventive, again, with pet therapy, having the horses come to visit the home. Here we have a resident holding up an all about me picture. And I think they were having a wine and cheese party there. If we go to the next slide, Niagara again, they had a on the wheel ice cream truck. Tim Hortons time was very important also, and also intergenerational. Everybody loves when the babies and the young children comes into the home. So if we just skip to the next slide, I see Neil there.
Yes, thank
How am I doing for
Julian.
time?
I think we're getting short on time.
Okay.
So I don't know if you want to summarize or end just before we because we want to make sure there's time for questions.
Yes. So I will summarize to say that QUIS has been a lovely journey for us. The homes has adapted to having that tool to foster change and enhance the relationships, not only with the residents, but also amongst the staff members. In quite a few homes, we've encouraged them to put up a QUIS board, and it has all the levels of interaction on there. It has their score and things that they're doing to improve it, along with pictures of the staff and the residents interacting in fun activities in the home on a monthly basis. So thank you all for being a captive audience and going through the silent moments with me, as well as the highlights of this project.
Thank you, Julian. I mean, it was such a wonderful and illuminating example of just one of the ways that some of those homes that participate in our programs really was supporting both the interaction of staff and residents. So such a beautiful example. And I did want to just summarize very quickly a little bit more, just early impacts and outcome. And you could see, I mean, we'll share these slides, but just at a programmatic level, in terms of what has enabled positive impacts on resident-centered care. And I think, again, Julian has talked more in real life, some examples of this, but creating a more home-like environment and increasing staff one-on-one engagement. So, I mean, those are just some examples. These are early results, but 94% of respondents who participate in our program said that they increased their confidence in supporting and providing person-centered care, and all teams either somewhat or fully achieved their project aim. In terms of those teams that participated and were focused on the reduction of inappropriate antipsychotic use, 59% of those homes were able to decrease it with an average decrease of around 8%. And again, when HEC is involved in undertaking these larger programs, one of the things that we look for is not only those outcomes, but did people feel more confident to do quality improvement? And you can see those results. And were they able to spread, or are they thinking about spreading their change to other sites or units? And again, lots of positive impact. I can talk to you about the lessons learned, but I think if you work in long-term care, these will probably sound familiar. So we'll just end it here with just one of some quotes from people who participated in the program. I was able to truly learn about our residents and work towards strategies and solutions with the clinic team. And that's our contact information, but we'll look to share those slides with you afterwards.